So I'm going to show you practically now how to do your primary survey. Okay, so I've checked for danger. There's nothing around that looks like it's going to cause me or my casualty any harm. So now I'm going to check for response. I'm going to talk into both ears just in case there's any hearing impairment at all in one of the ears. Hello, can you hear me? Can you open your eyes? If that doesn't work, a little tap or shake on the shoulder. Okay, there's no response. So like I said earlier, if you're on your own at this point, shout for some help. Can I have some help? Now we're going to open the airway using a head tilt chin lift. So one hand on the forehead, two fingers underneath the chin, lift the chin and tilt the head back. So I've opened the airway. I'm now going to check for breathing. So I'm looking for the rise and fall of the chest, and I'm listening for breathing, and I'm feeling for the breath on my cheek as well. So he is breathing normally. Okay. So if I have any help at this point, I'm going to ask them to just stand by, and I will shortly be asking them for a first aid kit and an ambulance as well if he hasn't come to. So I'm going to place him in a recovery position now. So I mentioned this earlier, and this is just a safe position to maintain an open airway. If I leave him on his back, the tongue might relax on the back of the throat, which could cause him to not be able to breathe. Also, he could be sick and he could choke on the vomit. Okay, so first of all, for your recovery position, what we're going to do is place the arm closest to us, up out of the way, and just wherever that falls naturally, don't try and force it down, just as though it's out the way. So I'm going to bring him towards me in a moment. I don't want him to squash his arm. I'm going to lean over and grab the far arm, and I'm going to link fingers with the casualty, and I'm going to place his hand against his cheek, and I'm going to continue to hold the hand there. You might have to shuffle down a little bit, because what you're going to do now is grab the outside of the leg that's furthest away from you, and you're going to lift that as high as you possibly can so the foot is as close to the bottom as possible. That is now your lever, so any size casualty should be able to turn any size casualty. Okay, so I'm going to push down quite firm to bring the casualty over and just take that foot off of his leg there. And then I'm going to slowly just take my hand away, and most importantly, I'm going to make sure the airway is open. Okay, so if he's like this, the airway is shut, so all I'm doing is just lifting the chin up slightly to make sure the airway is open. A couple of other things to think about before you turn your casualty is, do they have anything in their pockets? If they do, consider turning them to the side that they don't have anything in, or maybe take it out, but just be careful and place that by the casualty's head. Also, if your casualty is wearing glasses, you may want to take those off because they might be uncomfortable for them. But again, just make sure they're by the casualty's head, so if they do start to come to, we can quickly get them back on for them. Also, if you have a lady that's quite heavily pregnant, then lay them towards the left side. That is safer for the lady and the baby. Okay, so I'm now going to ask my helper to go and call 999 because I have an adult casualty that is breathing normally but is unresponsive and has been for a good couple of minutes.